Dr. Auld, so you are choosing to pursue implant training. How come?
Okay, whenever I first got out of dental school, I had some experience with implantology in school, but nothing really surgical. I felt like I had a basic understanding of the advantage that patients would have from implants, single tooth loss, denture stabilization, things like that. But I didn't really know much about the details other than restoring it. And so I found myself, because of that, in my location in a small community, I wasn't really treatment planning the way I wanted to treatment plan. I was finding myself doing more 3-unit bridges, even though I felt like it would be more beneficial for the patient to have the implant. Part of that was just because the difficulty of the whole multiple provider setting that was involved with some of those cases. I tried to send some of my patients to specialists, see them in their recalls, they would never go, and thought there might be a better way. And if some of those cases were able to be handled in a single provider setting, I thought my patients might be more apt to want to do it. That's what led me to first look into the surgical aspect of the treatment.
My next question is, now that you've chosen to pursue implant training, why is it that you've chosen the McGarry Implant Institute?
This course was specifically recommended to me by a couple different people. That I'd taken some of the weekend courses that you can just go, and I learned some things at those, but I still didn't have the confidence level that I felt like was necessary to really do some of the surgical things that were involved. When I talked to the rep who sold the implants to the system that we bought, he recommended this course. He said that most of the doctors who have gone to this course place more implants, they feel more confident. I found that to be true. Since halfway through the course, we've already spent an extensive amount of time on anatomy, learning exactly what you need to be concerned about, how to handle things if it didn't go like you wanted to. Dr. O'Donoghue, who's the head of anatomy here at the Oklahoma School of Science, actually brings in cadavers, so we have heads that we can work on. You can place implants, you can see exactly where you need to go, you can see the anatomy that you need to be concerned with, and I feel like that sort of training is necessary for doctors who want to place implants. As you get further into it, you have a little bit more of the background that you need to safely handle the surgery when you're placing these implants in your patients. So I'd recommend this course to any doctor who is seriously considering implants in their practice.